Hello everyone, I'm Feyishayo Olufunke Oyewole. I'm a student of Aspen University pursuing my RN to BSN. This is Module 8 work in Essentials of Nursing Research N494. I want to say a big thank you to our professors, Professor Alicia Intin and Professor Marusili Linda. I also want to say a big congratulations to my classmates and to myself on the completion of Essentials of Nursing Research. The topic of my presentation is Educating Clinical Staff and Disseminating Outcomes, Self-Reflection. Objectives of the presentation include evidence-based teaching to clinical staff using educational strategies, implementations of evidence-based practice by establishing strategic plans, theories and models, description and application to practice implementation, and the development of clinical practice change and presentation. Implementing strategic plans for practice change in my clinical area. Formal implementation team will be established. Dissemination of evidences, sharing of experience and provision of time to assimilate the new practice. Clinical tools development through revision of patient care records, provision of access to clinical resources, and the use of reminders and staff exposure to evidence-based information. Implementing strategic plans for practice change in my clinical area. The use of pilot tests to address the major problem and making a final decision at the end of the pilot test whether to adapt, adopt, or abandon the project. Preservation of sources of energy by anticipating barriers and the use of patience and persistence to overcome the identified barriers. Implementing strategic plans for practice change in my clinical area. Give enough time by having a timeline and increase the project step development. Success celebration through acknowledgement, appreciation, and recognition of staff members, supervisors, and administrators. Operationalization of practice change in my clinical area. The clinical problem is prevention and management of obesity in my clinical area. My clinical area is emergency department, emergency room of a hospital. Obesity is a public health issue in the United States and globally. It has many complications that raise the health care costs. Obesity causes frequent hospital and emergency room visits by precipitating other medical conditions. Operationalizing of practice change in my clinical area. Establishment of implementation teams, registered nurses, advanced practice nurses, nutritionists, dietitians, therapists, scientists, and other clinical staff members will be involved in the implementation team. There will be display of passion for this change in practice, and I will also encourage clinical staff to see the needs for the change. There will be creation of discomfort with the present condition, and I will bring in an outside speaker for motivation talk. Operationalizing practice change in my clinical area. Evidences dissemination. These are the evidences I found out myself, and they have been critically appraised by me. The use of simple self-intervention and management through low-intensity lifestyle program. The use of very low energy diets with severe and controlled energy restriction. The use of combination approaches which include surgical and pharmacology approaches, and as well as behavioral approaches. Operationalizing of practice change in my clinical area. Evidence dissemination continue. the use of population-based prevention method, community overweight and obesity management through the use of primary care-based weight management program, and the use of counterweight management program. Weight management and prevention should be made part of an employer-based health insurance and benefits. Operationalizing of practice change in my clinical area. Development of clinical tool. Exposure of my clinical staff to evidence-based information about prevention and management of obesity. Revision of patient care and documentation records, access to other clinical resources, and the use of alerts and reminders at point of care to assess patients for overweight and obesity, and also to educate them. Operationalizing of practice change in my clinical area. The use of pilot tests. Choose the pilot site. I will consider the unit strength and the leadership and patient population. I will determine what causes obesity in individual through the use of questionnaires or interviews. I will apply the best evidences so far. I will make decision at the end to adopt or to abandon the project. Operationalizing practice change in my clinical area. Preservation of energy resources. I will use the involved and supportive personnel. I will break the project down into smaller pieces and easily manageable ones. There may be setback. I will be prepared for that, and I will use patience and persistence to overcome barriers and the available setback. Operationalizing of practice change in my clinical area. Give the project enough time by having a timeline and by increasing the project step by step. Success. There will be success celebration, appreciation, acknowledgement, recognition of all the people that are instrumental to the success, the project accomplishments, the clinical staff, the supervisors, the administrators, and the management. Summarily, all the members of the implementation team will be appreciated. Theoretical model to use. The model for evidence-based practice change will be used. It will guide in 6 steps. The first step is the assessment of the need for change in practice. Why do we need to change the former practice? Despite measures put in place to control obesity, obesity continues to increase among Americans. Obesity prevention and management is an ongoing process. Further research and intervention will be needed. Theoretical model to use. Location of the best evidences. 6 best evidences have been identified by me. Critical analysis of the evidence was done through the use of method-specific and general method of appraising both quantity and quality research evidences. Practice change has been planned through the use of strategic plans discussed earlier in this presentation. Theoretical model to use. Changes in practice will be implemented and evaluated. Integration and maintenance of change in practice is an ongoing step. EBP is evidence-based practice. EBP is the shortened form of evidence-based practice. Barriers to successful implementation of evidence-based practice. Lack of evidence-based practice mentors. Implementation team will be established to foster successful implementation. Lack of evidence-based practice knowledge and skills. There will be continuous education, conferences, interactive work, and skill-building activities. Barrier to successful implementation of EBP continued. Lack of organizational support. Each organization should be mandated to support the implementation of evidence-based practice. Resistance to change. Clinicians and evidence-based practice stakeholders should be encouraged to further their education and be open to changes. Lack of autonomy practices. Clinicians should be allowed to practice in their full capacity. Evidence-based practice, we have always done it that way. This is resistance, diagrammatic representation of resistance. Sources of internal evidence for data provision. Evidence-based practice is equal to evidences plus clinical expertise plus patient preferences and values. Evidences could be internal or external. External evidence is from research. Internal evidence is from the practice experience and initiative. Evidence-based practice integrates best research evidence, patient values, and clinical expertise. Sources of internal evidence for data provision for improvement outcome. Sources of internal evidence include outcome management and quality improvement statistics, patient record and document, electronic health records, clinical system, patient turnout rate in emergency department for obesity-related medical cases. Ethical consideration. There are ethical considerations in this study: privacy protection and confidentiality, informed consent, respect for cultural diversity, non-stigmatization and non-discrimination, benefit and harm, human rights and dignity, individual responsibility and autonomy. Evaluation method of evidence-based practice implementation. Evaluation could be ongoing, terminal or summative. Environmental and goal monitoring, feedback from the client, reduction in the number of obese and overweight individuals, self-help and self-management to weight loss. References. These are the references I use where I synthesize my evidences. These are them. These are all the references. Thank you, everyone.